They don't just treat the medical, it's kind of an emotional treatment you get here as well.
I think every patient's special, so I always try to go in and treat them like they were my own child. And if they're having a hard time, support them, help them. I want to do everything I can to help kind of make the visit as easy as possible.
Shriners is awesome. We're so thankful. I think the people that work here really enjoy what they're doing. I think they like working with kids.
Something about kids, they're very genuine, and it's fun to be with people that are genuine and so easy to love.
Shriners is special because they make me feel good and make me feel safe, and they just make me feel really special.
They really care, and you can tell they really care.
All around, they're just good people with caring hearts.
Everything that Lauren needed to be the healthiest she could possibly be, they could provide for us. She loves coming to the doctor. It's just a place that it's like home, it's bright, it's happy.
There's such a camaraderie here, it seems, between the parents and the nurses and everybody. They work with the parents. They're not working on your child. It's like they're working with your family to make your child's life better.
It really doesn't feel like a hospital. It doesn't feel like a clinic. It feels like, a fun place to go.
What better healing is there than make a kid feel like a kid? You keep them in a hospital bed all the time and they never get up. Then mentally they're going to be beaten. You put them into this game room and you watch the kid's face like, I get to be a kid. This is awesome. Right? And that's,
Our philosophy is that we put the patient in the center of our care, center of our universe. We wrap the care around the patient so the families, the kids, everybody is part of that plan, more like a family.
They just treated him like he was a person. They would talk to him first and me second, so it wasn't like they talked to me like he didn't exist.
We're not treating just the patient here. We're treating the whole family, the parent. And so we sometimes have to address the child's needs as well as the parent's need.
It's that individual, treatment and care that we do that sets us apart from, any other, hospital, any other children's hospital.
I think the fact that Shriners can specialize, that this hospital can specialize only in bones, everybody here's got a common ground.
So we don't actually treat adults. We all did separate training specifically for children. So for that very reason that we want to focus on the children's needs. We focus on anything related to childhood bone and joint diseases. So that can vary from simple little wrist fracture that a 4-year-old might incur from falling in the playground to complex spinal deformities or adolescent hip preservation surgery.
They put colors on it, so I'm not really worried about it, because who would like a white cast? Nobody would.
The mission of the Shrine is threefold, and the first being providing quality orthopedic care to our children, and that's our primary mission. But there are two other parts that are equally as important, and that's providing education to our providers, to healthcare professionals, and the third is research.
There's no assembly line kind of mentality here. Every kid's unique. We just want to treat kids with orthopedic problems.
We see patients as early as a week of age up to 18 years of age.
Even though we're known mainly for doing orthopedic surgery here, there's a number of other services that we offer.
Radiology and laboratory services, rehab, which includes physical therapy, occupational therapy, recreation therapy.
Having everything under one facility helps us coordinate the care. So we're seeing the kid from our clinics to the operating room, to the recovery room, back down to our inpatient unit, and the same staff is following that kid throughout their course here at Shriners, not only during their one visit, but across their entire childhood.
There wasn't a point for me where I felt like we were strangers to anybody here. From the first day we walked in here till the last time we were here, 3 years later.
I've known the people here all my life, practically. And they treat me so well. They just want you to be happy and not scared and nervous.
Sounds like they care.
Well, they care a lot.
Shriners has answered every question we've had. Shriners has gone above and beyond to allay our fears. We are so glad we came to Shriners.
I just can't think of any other place that does what Shriners does, for kids especially.
As a parent, you want the best care possible for your children, and I think this is the best place to bring her.
As a parent, that's what you're looking for. You're looking to come to the best, and I truly believe, we have some of the very best here in orthopedics.
I've worked in healthcare, and you can tell when somebody really cares about the patients and when they're just doing a job, and they care here.
There's nothing better than watching a child run up the hallway to you because they're excited to come see you. I love working with kids. That's the best feeling in the whole world.
They're not like a normal hospital. They care. They come here because they want to be here and they want to make you feel at home.
Just completely unbelievable what they were able to do for us and what I see them do for other people.
Just want to thank everyone at the Shriners for what they've done, for their caring attitude, for the wonderful things they've done for my family. I just can't say enough about them. I really thank them.
Thanks, Shriners.
Thanks, Shriners.
Like, it was just one of those places that you want to be.
Shriners is awesome.
Shriners is the best.
Shriners is awesome.
Feels like family here.
Shriners is, yeah, definitely like family.
Everybody who's ever involved with Shriners, thank you, because it's amazing.